I'm going to explain the effect of autonomic nervous system drugs on the pupil. The pupil size is controlled by two opposing muscles in the iris, the sphincter pupilli and the dilator pupilli. The sphincter pupilli muscle has a circular fibers. When it contracts, the pupil becomes smaller. This is called meiosis. While the dilator pupilli muscle has the radial fibers. When it contracts, the pupil widens, and this is called mydriasis. Now I'm going to explain the effect of cholinergic, anticholinergic, adrenergic, and anti-adrenergic drugs on the pupil. The cholinergic drugs act on M3 receptors in the sphincter pupilli. So the cholinergic agonist, like pilocarpine, stimulate the M3 receptors, causing the sphincter pupilli to contract. This contraction leads to meiosis, and these drugs are used for glaucoma. Now let's move to the anticholinergic drugs like atropine, which is block M3 receptors, preventing sphincter contraction. As a result, the dilator muscle dominates, leading to passive mydriasis. These drugs are used for eye exams and fundoscopy. The adrenergic drugs act on alpha-1 receptors in the dilator pupilli. So the adrenergic agonist, like phenylephrine, activate the alpha-1 receptors in the dilator pupilli, causing it to contract and produce active mydriasis. These drugs are used for fundus examination, so you can make a connection between the uses of adrenergic agonist and anticholinergic drugs, which are also used for eye exams and fundoscopy. But you should know that anticholinergic drugs lead to passive mydriasis, while adrenergic agonists lead to active mydriasis. Now let's move to the anti-adrenergic drugs, which are alpha-1 blockers, prevent the contraction of the dilator muscle, allowing the sphincter pupilli to take over, leading to passive meiosis. The difference between active and passive effect is very important. Active responses are due to direct muscle contraction, while passive responses happen when the opposing muscle is weakened. So by understanding this mechanism, we can see why different drugs affect the pupil in specific ways and how they are used in medical practice. I hope this explanation was clear. Thank you for watching.